Hi everyone and welcome back to another video. I'm your girl Shira and today we're going to talk about what your baby really looks like when they are born. The first thing to know is your baby will have vernix. It's a white, cheesy, wax-like substance that the baby's body develops as protection from bacteria and infection. This substance appears all over the body and should not be washed off. Instead, you would want to rub the substance into the baby's skin thoroughly and not bathe the baby for at least 24 to 48 hours. This is truly beneficial to your baby's development as it continues to provide a protective role and provides the baby with that soft skin we all know and love them to have. Without vernix, the baby's skin would chap and wrinkle in the womb. Cone head, also known as molding. This only happens during a vaginal birth. Typically, you would notice the deformation at the middle to the back of the baby's head, as it takes this cone shape to fit through the birth canal. A baby's head is very soft and easy to mold. After about 24 hours or a few days, the baby's head will naturally form to a round shape. Cyanosis. This is when the skin of the baby has a bluish-purple cast and appears most where the skin of the baby is thin. This is caused by low oxygen in the baby's body. Usually, doctors may give an injection to the baby to help them with this problem. Jaundice. This is the yellow discoloration of the baby's skin and the whites of their eyes. This is caused by an excess of a yellow pigment in the baby's red blood cells called bilirubin. Babies with jaundice has to stay in the hospital a bit longer where the doctors provide the baby with fluids, phototherapy, or a blood transfusion. Once the doctor declares the baby is clear to go, family should be fine and the baby should be okay. Lanugo is just a fancy word for hairy. This is the hair that covers some newborns, sometimes everywhere on their body, except for the palm of their hands, their lips, and the bottom of their feet. This is the first hair the baby grows from their follicles. Most fetuses develop lanugo around the 4th or 5th month of pregnancy. This helps keep the baby warm and regulates their body temperature until they have enough fat under their skin. It usually goes away on its own and is completely normal. Mongolian spots, usually common in dark-skinned babies. They are bluish-gray congenital birthmarks that appear on the baby's skin, usually around the buttocks and lower back. The spots disappear on their own as the baby gets older. Cephalohematoma is the collection of blood between the baby's scalp and the skull. This happens because of damaged blood vessels, which releases blood into a mass underneath the skin of the scalp. This usually happens during labor and delivery. The best thing to do is to leave the area alone and allow the baby's body to reabsorb the fluid. Cradle cap. This is the flaking, scaling, or the thick crust you see on the baby's scalp. It does not bother the baby, but it can cause crusty or oily, scaly patches on the baby's scalp. Please do not pick the scales. Instead, apply coconut oil on the baby's scalp. And when the scales are no longer attached to the scalp of the baby, gently comb them out of the baby's hair. Cradle cap usually goes away on its own after a few weeks. Milia. Tiny white bumps on the baby's nose, chin, and cheeks. They are very common in newborns but can appear at any age. Milia cannot be prevented and they usually disappear on their own after a few weeks. Newborn rash is a normal looking rash that usually appears on the baby's face. Some may even refer to it as baby acne. It usually goes away on its own as the baby gets older. Flathead. Flathead syndrome is exactly as its name. A baby whose head is flat on one side. This usually occurs because of the baby's excessive sleeping on their back or laying in a rocker or car seat. This is treatable. You can reduce the pressure on the baby's skull by changing the baby's position, practicing baby wearing, and allowing your baby to do some tummy time. I hope you all enjoyed this video. This is all we have for today. If you like this video, please like and subscribe to this channel, and please share if you care. Until next time, stay blessed.